So the most common problem as far as dental practice is concerned in our country, India, is bargaining patients, because there is always there someone to do something for cheaper. But let's not fall in that trap, because you can't match the quality if you're doing it for a cheap price. So, and the more over and above, the bitterness of poor quality remains long after the sweetness of low prices forgotten. So, believe me, how I tackle my bargaining patients, I have a standard way of talking to them. I have kept my clinic as a no bargain zone. So, the moment the patient tries to bargain with me in form of rate, I just tell them, sorry, sir, it's a non-negotiable amount. Its amount is same for everyone. If you feel it is worth it, please go ahead with the treatment. If you feel it is more, then there are so many other options available. Maybe initially you will feel that you're losing some patients, but at the end of the day, you will feel it is worth it, because you'll have a better sleep at night, and whichever patient is coming to your clinic, they will never argue about the money. So you can concentrate more on the quality of work rather than the amount which has to be collected from the patient. Case selection is very important, and you should know how to say no. As in ki there you will get many patients who are very cribby about many things. Maybe their expectation is very high, and so if you feel that you will not be able to match up till their expectations, please don't proceed. Or in case of a very highly medically compromised patient, you should not proceed unless and until you are assured that he is fit for dental treatment. Whenever a patient comes to you, you should address the chief complaint of the patient first. You should never uh, do what you feel like, because for suppose a patient is coming with a severe toothache and you see lots of calculus there. Ideally speaking, that as far as what we had learned in the dental school days, dental college days, they say no, oral prophylaxis is first, it comes in the first in the treatment plan. Yes, it is right theoretically, but practically, as far as clinical experience is concerned, it should not be like that. You have to address the chief complaint first, and once you have the patient is away from the chief complaint, once that chief complaint is solved, he'll become your fan, and then slowly and steadily you can ask him to proceed toward other things which you have noticed clinically. Before making a treatment, you should also make a proper treatment plan before starting any case. And whenever you are doing it, please make sure that what if something goes wrong. Suppose I'm planning an implant. What if the implant fails? You should have a plan B in your mind. It should be a bridge or a partial denture, whatever it is, but a plan B should always be there. And be realistic in your approach. Never give false hopes to the patient. For example, a patient is having very resorbed ridges, and while making a complete denture, you say, no, no, you'll have very good retention, you'll be able to eat everything right from the first day. Don't talk all rubbish things. Be We have to be very positive, and you have to be realistic. And the way you talk, you have to be confident in the way you talk to the patient and explain the treatment plan. Suppose a patient comes to you and you talk to the patient. Yes, we will try root canal treatment, and if it succeeds, you'll be pain free. No, that is not the way how you talk. You have to say, yes, we'll be doing root canal treatment for you, and by the end of the day, you'll have a smile on your face, and go back home without pain. So the way how you talk, the patient is noticing everything. And when you explain the treatment plan, give it, don't talk hi-fi dentistry words. Talk in the simplest possible words what you can think of, and always give examples. And you can also show photographs, like for example, root canal treatment, how a abscess heals. All such things it should be shown. Nowadays, all the patients coming to our clinic, not only my clinic, to all others clinic, they have done sufficient research over in the internet, and then they have come. So never try to fool a patient. talk what is genuine. Many people called in root canal, they called GP as artificial nerves. That is all nonsense. So make sure you're talking to whichever patient you're talking to. Don't just beat around the bush. Be practical and speak truthfully. Always concentrate on the quality and not on the quantity of work, because running behind a building, a name, the money will automatically follow its path. So suppose you are having a patient in which more money is there, but you feel that if you choose an alternate treatment plan, and if that is correct and if that is going to give you more name, then prefer that over money, because the money always follows name, but the vice versa is not true. Take consent from the patient as far as possible, because you should treat every patient as if he's going to sue you in the future. And nowadays indemnity insurance has come up in many countries, so you always it's good that if you take indemnity insurance, at least you have good sleep at night. Now nowadays most of us are using RVG. So this RVG, it's a very delicate equipment, so, and very highly prone to attack from rats and mouses. So these cable protectors are available online. You can purchase them and you just wrap it over your RVG so that the bend or cut on the wire does not take place. And you should also use portable or DC X-ray, because the radiation is really low and you are able to give very good and sharp images, and your radiation is low, so the chances of cancer to you is also less. Intraoral camera, it's not a very new thing, it's a pretty old thing, but believe me, most of the dentists do not use it. But if you use it, believe me, if you spend 5,000 on a simple 5,000 rupees, I mean to say, on a simple intraoral camera, it is going to give you 5 lakhs in the coming 5 years. Believe me, these are the statistics, because the convincing power of an intraoral camera is very high. And jokes apart, believe me, if a husband and wife has come to your clinic, believe me, if somehow you focus the intraoral camera on the husband's teeth and the wife sees how dirty it is, believe me, within a next 1 week, the husband will come running to you for getting your scaling done. Treatment charges, should it be high or should it be low? It should be according to the area, and also according to your expertise, and also on the equipments you have. And at the end of the day, patient should feel that whatever amount they have paid, it is worth the amount he has paid for. Don't let the patient think that, okay, I paid so much and it is not worth it. It should not be like that. Now, many consultants also work in dentistry, but it's my sincere suggestion to all the postgraduate consultants that many of them, they don't focus on their own clinic and they focus only on consultancy. But believe me, if you earn 500 today in someone else's clinic, I'm sorry, if you earn 500 in your own clinic and 5,000 in someone else's clinic as a consultant, believe me, this 500 is bigger than that 5,000, because in the coming days, this 500 is going to become more than 5,000, because it is going to give you name. But the place where you got 5,000 today, that that name is not yours, it belongs to someone else. I suggest everyone to use branded sutures, not that thread and the needle one. Use the branded ones. Never treat a stranger. Always take a proper history, because you never know, patient might be on ecospline therapy. A patient might be having so many disorders. So take a proper history first. Know the patient well, and history, I mean to say medical and dental history, and then only you should proceed with the treatment. While doing the extraction, it is said that the tooth belongs to the surgeon, but the bone belongs to the patient. Always remember that. You can split, you can cut the tooth as the way you can, but try to conserve as much bone as possible. You should be judicious in the use of local anesthesia. Lignocaine with adrenaline and without adrenaline should be there. Many clinics I have seen, they have only just lignocaine with adrenaline. With the plain ones they don't have, but in cardiac patient, hypertensive patients, it should be there. And nowadays articaine has also become popular, and you can use articaine especially for hot tooth and intrapulpar or intraligamentary anesthesia. Nowadays, in India, they have launched, the Woodpecker company, they have launched a new digital local anesthetic injection, and believe me, it is almost painless even for a child for as small as 4 years of age. Never use cotton in extraction. It has those fine threads which get stuck in the socket, so it should be avoided. Use a sterile gauze instead. Always give written post extraction instructions, because at a later date patient should not hold you responsible saying that you didn't tell me you this, you didn't tell me that. All that written post extraction instruction should be given. In our country, Indian subcontinent, oral submucous fibrosis is pretty common, and also some pre-malignant lesions like leukoplakia, erythroplakia is also there. So it is my sincere advice that you should never start treating a patient of OSMF until and unless you are convinced that the patient has stopped or reduced his tobacco intake. Nowadays, pulp devitalizing agents are getting less popular day by day, because as far as the theory says, a good BMP is the best pulp devitalizing agents. And let me tell you, all the pulp devitalizing agents available in the market today, they almost all of them are carcinogenic. So please avoid doing that. Do the biomechanical preparation on the day of access opening itself, and it will give you much better results. And try to practice single visit endodontics, or maybe at max 2 appointments, not more than that, for a single tooth root canal. And always avoid open dressings, because it always leads to accumulation of E. faecalis, which later leads to root canal failure in the future. Use a LED air rotor handpiece. It's really good. It increases your efficiency, and the torque of the handpiece should never be more than 2.5 Newton centimeter, because for any handpiece, whether it is LED or the normal handpiece, because that is going to ruin your handpiece. So many irrigant solutions are there. The sodium hypochlorite is the gold standard, and apart from that, 2% chlorhexidine EDTA in liquid form should also be used. But copious irrigation is actually the success to good root canal. When you are removing a temporary, use a scaler instead of aerotor. It increases the life of the aerotor, as well as it does not cut away unnecessary dentine. And use an ultrasonic scaler to remove pulse stone to avoid perforation. Now, there is a new product. Many people complain of post restoration sensitivity after using composites. So you can always use a cavity liner to reduce that problem in composites, and always prefer composite over GIC. Always invest in a branded light cure machine. Don't go for the cheap ones, because the cheap ones, their wavelength is not proper, and the composite resin is not getting cured properly. When you had studied dentistry, the amalgam preparations used to give undercut, but when we came to composite and GIC, they said make a conservative preparation. But if you want to prevent your restoration from getting dislodged, you can you can put small undercuts, retentive grooves, and they will help the teeth, the restoration from coming out. Use a composite polishing disc for anterior teeth. It gives a good finish. I say rubber dam. I don't say, all of us always already know that rubber dam is the gold standard for isolation, but sometimes even Teflon tape, especially in anterior composites, I call it a silver standard. Use a paper point to dry the canal, not just cotton, because that is the way how it should be done, and there is no shortcut for that. Try using shifting yourself from alginate to elastomeric impression, and nowadays it's the era of digital impressions. But those who cannot afford a digital scanner, you can at least move towards elastomeric impression materials, and they will definitely reduce your chair time and increase the quality of your prosthetic work what you are delivering to your patient. Use a dye stone to pour your models, not just dental stone, because the accuracy is much more. Whenever you are using cementing a long span bridge, or foul mouth cases, always use a temporary luting cement for long span cases, because if any ceramic chip off is there, you can take care of that. Never ever give distal cantilever bridges, because today or tomorrow it has to fail, and the entire, even the healthy tooth on which you have taken abutment, even that will go. Stabilize the contralateral arch crowns before luting on the other arch processes whenever you are doing multiple crowns and bridges. The crown speaks about the quality of work being done in a particular clinic. So lab selection is very important. Maybe you have to spend a few bucks extra, but always try to give your work to a good lab, and in the long run, it will help you. Be judicious in the use of luting cements. Apart from GIC type 1, you can also use resin modified GIC and resin cements. Although resin cements are slightly more expensive, but the retention is much more, and it's always gives you a better name. Usually, people think that pedo patient, usually people think that the pedo patient, the charges should be lesser than adults, but in my experience, you spend more time, you spend more materials on doing a pedo patient. So you should always, I feel that treatment charges for pedo patients should be either more than the adults or at least equivalent. It should never be less for pedo patients. Give sufficient time for scaling. Don't just be lazy while doing it, and invest in a good and expensive scaler, and always try to do polishing after scaling. Put lots of efforts on your ortho patients. They are your biggest publicity, because one ortho patient, it moves around in the market for say around 1.5 years, and everywhere he goes, everyone asks him, where are you getting your treatment done? So basically that patient is a free publicity for you. So you should put lots of efforts in giving quality orthodontic work, and also to convince patients to get their orthodontic treatment done. Convincing ortho patient is never easy, but I try to show this photograph and convince them by showing this photograph that how the patient's confidence level has increased, her smile has improved, and so many other things related. The patient appointment system is one of the biggest headache what I face in my clinic, because I have used clinical practice management softwares, reminders, phone calls, and I'm actually fed up of that. People don't be on time, they're always late. So nowadays I've started using WhatsApp, and I ask the patients to WhatsApp on the clinic number whenever they want to take an appointment. That is slightly better, but still it is not a foolproof way. But time management becomes very difficult, because if your time management is good, you'll be able to do more and more number of patients. So that is also there. Clinical budgeting, you should allot your clinical budgeting as like, if you ask me, I will say I spend 5 to 10% of my annual income back to my clinic. I reinvest, whether I buy equipments or buy something new. Like last year, I bought an OPG machine. So that is important. You should keep updating yourself from time to time. Always use disposable items where as and where possible. Get your dental chair laminated, and always maintain cleanliness in your clinic, because if it is not clean, patient seems to get distracted away. So there should be a pleasing, healthy environment. Try to bring a smile on the patient's face by all possible means. The all possible means, I mean to say, whether it is by doing good treatment, or if not anything else, at least you can crack a simple joke or just talk to the child of the patient. Somehow you have to bring a smile on that patient, and believe me, once the patient smiles in front of you, the patient will always be yours. The patient will never go to anyone else. Buy good instruments. Never use old rusted instruments in the operatory area, because it gives bad signal about your clinic. Keep medical records and follow up x-rays and photos, firstly to show to the patient, because many a times the patient will come and tell you such and such treatment was done by you, but see, it has failed. So you should have sufficient evidence to prove that this particular treatment was not done at your clinic, because invariably the patient has already lost his prescription. So whichever treatment is there in his mouth, he will feel it has been done by you, but actually that is not it. Maybe someone else, some previous dentist has also done it, who has not done up to the mark work. So you should have sufficient proof for yourself that the such and such treatment has been done by you. Go for advanced diagnostic aids. You can go for OPG, you can go for CBCT, and nowadays it's the era of CBCT in which even for getting for doing a root canal, people are getting CBCT done to make sure if there are any extra canals are there or if there is any problem in the root canal structure, to know the actual anatomy of the tooth. It makes your works more easier and more accurate. According to me, the word of mouth is the best form of publicity. And because if you do good work, your name is going to spread like wildfire. And believe me, I always tell to all my listeners, suppose you enter a room with a white wall. The moment you enter, and suppose there is a black dot on the wall, the moment you enter the room, the first thing you'll notice is the black dot, and you'll not see that the entire wall is white, but you'll see that, oh, there is a black spot. So always make sure you have a good name. Your reputation should be there. A black dot should not be there, because one mistake that can spoil your name which you have earned over so many years. And as I told you before, name is always more important than money. Money comes secondary. Primary is name. You have to be a tech savvy, make a Google page, website, and ask your well-to-do literate patients to write Google reviews, because in the long run it works a lot. You have to be humble, polite, and courteous in your behavior, but you have to be strict with the treatment plan. Whatever plan you have made, that should be binding on the patient. And no one else, that patient or the dentist relative of the patient, should not enforce upon you about the treatment plan what they desire. If you feel there is some discrepancy, some error in that, you should accept and explain to the patient that why you are not agreeing with their treatment plan. One big problem with dental clinics is the dental staff, the assistants, they tend to take a lot of leaves, and they tend to run away a lot. So I always suggest to all my friends, give regular incentives to your staff, give them an annual increment, and manage their leaves, and reward them for not taking leaves. Suppose you give 4 days a leave in a month, and if they have not taken 4 days leave, you say, okay, fine, I'll give you 1 day salary extra, 2 days salary extra. So that helps. So that is all from my side. Thank you very much. It was my pleasure speaking for all of you. Thank you.